Hello and welcome. Today we are going to talk about lipodema. Lipodema is an adipofascial disorder that almost exclusively affects women. Lipodema leads to chronic pain, swelling, and other discomforts due to the bilateral and asymmetrical expansion of the subcutaneous adipose tissue. Lipodema affects nearly 11% of adult women. However, in the clinic, lipodema is frequently misdiagnosed. It is distinct in manifestation as solely affecting the upper and lower extremities with a disposition of subcutaneous fat. Skin depressions with pearl-like to apple-sized masses form in the skin, and these permeable fascia that thicken and contract eventually cause pain to the client. Now, another study says that it is proposed that the prevalence of lipodema is nearly 1 in 72,000. Lipodema predominantly affects females, but has been reported rarely in males. Few reports mentioned the prevalence of lipodema, around 11% in adults and 6.5% in the US and 15 to 18% in European countries. So some treatments and management. The diet helps to manage obesity, and that often accompanies lipodema. Generally, lipodema is fat that is resistant to weight loss with diet. However, few reports do suggest that ketogenic diets do help. Despite exercise, body parts that lipodema does affect continue to grow, and although that is an effect of it, it's still graded exercises is recommended for certain people who have unhealthy lifestyles. And also, few reports suggest water exercise helps mobilize the fluid, softens the fibrotic tissues, and then allows some of that to break apart. Now, there is a thing called pneumatic compression devices, which is those legs compressions that kind of pump air in and out to kind of encourage the lymphatic drainage to happen. But other things such as myofascial therapy and deep tissues, Graston techniques, and compression reduction techniques have been shown to reduce fibrosis and lipodema, fat, and increase blood flow to those issues. So this can help reduce some of that pain that people with lipodema actually have. And the reason why is because due to the fascia and what the fascia constrictions can do to the body. In lipodema, poor quality of life, immobility, and stress related to physical appearance can result into depression. Anything added into it, so if you go through a cold or if you get any kind of sickness or complication, adding stress to any of those factors affects how much those complications or even infections can affect our body. Constriction to the fascia actually affects the cardiovascular system. Remember, when fascia sticks to one another, this is what we consider a adhesion, aka a knot. And to say that the adipofascial disorder will not be affected by these knots that we encounter on a day-to-day basis is to say that it is not a adipofascial disorder, but it is just an adipose disorder or a fascial disorder if it's just one or the other. But it's not. It is both. Once again, I am John of Greater Therapeutics. Thank you guys so much for tuning in.